All right, so we're good to go. Okay, so again, community alignment specialist. And our job here, for me as a community alignment program supervisor, is to really work with agencies and providers to spread awareness on the partnership as well as Connect and NJ. Um, we want to be able to connect with the community as possible. I'm sure that many of you are aware that there's so many resources out in our community. However, there is some kind of disconnect between community residents and actual organizations and the services that are out there. So Connect and NJ, which I'll go into more details about, has an expansion, and they added two components, which is the community alignment program as well as the case management program. And what our goal is, again, to work with the community, see what the community needs, and get them connected to as many services as possible. So in the beginning, I'm going to talk about the partnership, and then I'll go into Connect and NJ. So the partnership has been out actually for, I want to say something like 30 years. Prior to the partnership, there was three different organizations located in northern New Jersey. They came together and created a consortium. Now they serve nearly 40,000 people every year, and we work out of 8 of the northern counties. So as you see there, we have Bergen, Essex, Hudson, Morris, Passaic, Sussex, Union, and Warren. The partnership, I believe, has about 30 programs. So depending on the program determines on what counties they cover. Some programs are statewide, so that means that they'll work out of all of the counties versus some are specific to certain counties and certain cities. Our mission statement is that we're changing the paradigm in maternal health by amplifying, supporting, and empowering our communities. We firmly believe all people must have access to safe, respectful births, and family deserves the opportunity, and every family deserves the opportunity to thrive. So what we believe is that, or what we believe in is that all birthing people can access safe births using best clinical practice. All children will maximize their potential to grow, learn, and thrive through the support of a healthy family and community. And all of our programs are free and voluntary for anyone who wants to participate. Most of our programs are offered in English and Spanish. Some programs are available in Creole and in Arabic speaking. And I'll explain which programs mainly are available in other languages. Another thing that I like to emphasize on this is that we do not ask for any type of documentation records. We don't ask for any ID or anything like that. You just give us your name, your address, your children's information, which I'll also go into more details when we start talking about how to complete a referral. So these are some of our programs, and the list is very long, and at first I did have a description of each program, but it was a lot. So instead I just labeled it, and then I was going to kind of tell you what each one's about. So our first one is Childhood-Led Poisoning Prevention Program. This program provides resources for a lead-free home to promote child development and get access to community programs and a healthy home kit. We actually do a lot of collaboration. I believe we are collaborating with Patterson Alliance, who is here today with Shaniqua Lemon, and I'm excited to see what comes out of that. I want to say October is Lead Awareness Month, so I know they're working on some stuff. And correct me if I'm wrong, Ms. Lemon, but I think that's how that goes. And then we also have a doula program. We have, we call it the Community of Caring, and it's a doula cooperative in Patterson and in the Newark area. Because those are like our areas that really need a lot of focus, especially with doula care. I want to say the one in Patterson works closely with St. Joseph. And then the one in Newark, they just had a graduating class, and they're working with, I believe, Beth Israel. Connect and NJ, I will skip for now because I will go into more details about that. We have our early childhood specialist program, and they do a lot of developmental and mental health promoting, and that's also a client-based program as well. We have emotional well-being for new parents, and that's any mom or birthing person that is struggling with depression or anxiety, and especially if they postpartum is a really big thing, and postpartum could last anywhere between the childbirth and up to a year. And honestly, studies have shown that it goes way past a year, that it can go past a year. So we have a program that focuses on that. It does say new parents. However, I've seen them work with families that have multiple children. And we try to provide support with that. That is also client-based and educational based. We do have family success centers. We have two. We have one in Irvington and we have one in Dover. We also have a fellas programs because we can't forget about the dads, and that is a fatherhood initiative. And then we have Healthy Women's Healthy Families. That is our community health worker program. And I'll go a little bit more details about that later. And then we have home visitation programs, and we have 3 home visitation. We have Healthy Families, Nurse Family Partnership, and Parents as Teachers. Each one, there is eligibility requirements, whether you're a first-time parent or depending on how far along you are in your gestation, like how many weeks and stuff like that, can determine which program you'll be eligible for. And again, most of them, all of them are offered in English and Spanish. We have immunization programs, and that's also educational based. And we have perinatal addiction project, also educational based. Premature prevention initiative. That one is focused on preterm birth. And then we also have 2 teen programs, Smart Choices for Healthy Life. They work with age-appropriate education students from grades K to 12, and they focus on fetal alcohol spectrum disorder. And then our teen education program that you see here is a school-based pregnancy prevention program that provides health education and teenagers to make safe and healthy decisions about their future. And then also, I'm not exactly sure if I have it here because I can't see my whole side. The professional and continuing education and engagement. So one thing that I really like I love all of our programs, but one thing that I really like is that we offer continuing education to like nurses and doctors. Whenever they are licensed by the state, they are required to, take certain classes in order to keep up with their requirements, and we offer those opportunities, and usually they're free. I know, for example, in April when I had just joined the team, and I started back in March. Back in April, we did a continuing education forum on cannabis and pregnancy, which was like a trending topic at the time, and it was really, really good because not only are you meeting your requirements, but you're learning about stuff that's currently trending. So those are an overview of our programs. Now, Connected NJ. Before I go into this, I'm not exactly sure who joined the meeting this morning, but First Lady Tammy Murphy had a Connected NJ vision planning event it's supposed to be like a 10-year plan. It was a 1-hour discussion from like 10 to 11, and it was really good. There was some really great questions, and I just thought it was really helpful. I took some of the information and updated my slides this morning after that, but it was a really good discussion. And they are going to have 2 more sessions. So maybe Miguelina, I could send you the link and you can share it with everyone else in case they're interested in seeing where the Connected NJ is planning to go within the next 10 years. But Connected NJ is a county level centralized point of entry referral system for pregnant people, fathers, and families with young children to access programs, services, and support. We are available either through telephone, in person, and virtually. Now, this is a statewide initiative, right? And I'm not exactly sure, but maybe before you heard it was Central Intake. That's what it was called before. But in 2019, First Lady, she launched the Nurture NJ. And with that, she took Central Intake, rebranded it, and transformed the referral system in a way that was making it more accessible. So she created an online referral system, which I'll explain in more details. But the partnership is the leading agency for 5 of those counties. So it's Bergen, Hudson, Morris, Passaic, and Union. So if you live in any of those counties and you want to be connected to this service, you would go through the partnership. And then I believe in the meeting I heard this morning, I think there's like 5 or 6 different hubs throughout the state that are the leading agency for this Connected NJ. So what they provide is easy access to resource information, referrals to community service to promote child and family well-being. They link people or families from pregnancy to age 5. They do case management service, developmental health promotion, and developmental screening. That's the developmental screening is mainly with our ECS program, which is Early Childhood Specialist Program. And then they do a lot of referrals to evidence-based home visitation programs and the Healthy Women's Healthy Families Program, which is the community health worker. Again, after this, I do talk about how to complete a referral, but after you submit the referral, we have resource specialists for each county. They call the participant within 24 to 48 hours. Once they communicate with them, they try to figure out all of their basic needs, whether it's food pantry, WIC, maybe they need help with housing or anything like that, and they screen them. If they're not able to do any form of like case management, like, provide where food pantries are or how they can get utility assistance, they assign them a community health worker. Prior to this position, I was actually a community health worker in Patterson at New Destiny Family Success Center. And, I understand firsthand what it's like. And it involves a lot of advocacy, a lot of education. It's a lot of support that's given through our Healthy Women's Healthy Families program. If they are not with the Healthy Women, Healthy Families program, then they are with a nurse that monitors not only the mother, but the child to make sure that they are meeting all of their needs all around, physically, emotionally, mentally, anything that they need. They try to connect them to as many services as possible or help them one-on-one with any issues. Okay, so now this is how you complete a self-referral. Again, First Lady Tammy Murphy took the central intake and revamped it. So prior to this website, you would have to go through an agency in order to get a referral, either an agency or a social worker or the hospital in order to be connected through this single point entry. Now, any family, any member, any community resident can go directly to this website and pretty much sign themselves up. So at the top, you see the website, www.nj.gov/connectednj. When you go on the website, this is the first thing that you see. As you can see, the website is offered in Spanish. So all you have to do is click that button. And then it takes them to the next page, which is the Connected NJ. This page right here tells you what county, what leading agency does the Connected NJ for that county. But what I did was we pointed an arrow to the exact link that you need to click the form, because if you scroll, and it's a little bit confusing, if you scroll down and go to the county and click the link, it takes you to the agency's website, not necessarily directly to the form. So it's very important that you just click the Connected NJ link. But if you had any questions, you can scroll down and find the county that receives the referral. In the beginning, as you can see here, you whether if you're helping them or if they're doing it themselves, they choose what options that best align to what they need. So whether it's childcare, breastfeeding support, and the more detailed you are with this form, the better we can help you. And then as you can see, if there's something that's not here, you're able to put it into the box. Whether it's like domestic violence or anything like that, you can put it here. Then we ask if they are a parent. And as you can see, there's a lot of asterisks. So the form is not going to be able to be submitted unless you at least complete all of the asterisks. So are you a parent? Are you a first-time mom? Wait, there's a slide missing. Okay, there's a slide missing. But prior to this, it has all of their basic information, which is like the name, address, phone number. They do ask what kind of insurance you have. And it's only because if we do call you and you say that you're uninsured, we can possibly connect you to how to get insurance. A fun fact I love to share is that a lot of families that are undocumented, if they get pregnant, they qualify for Medicaid through the whole entire prenatal experience, as well as 1 year postpartum. So when we get that information, if they're uninsured and they're pregnant, we can let them know about that service. That's just an example. And then, we ask for phone number, preferred language, all of that great stuff. I'd be able to go in more details if I didn't forget the slide, but this is what we have. And then at the bottom, you see that it says child. You could put up to 5 children, and you just put their date of birth and their name if you choose to. As you can see, there's no asterisks, and then we ask their relation. So, again, though, the more details you include, the better. And then here, now, again, this is a self-referral. However, we do see a lot of like social workers or faith-based organizations that complete this referral on behalf of someone else. So what we ask is that you or whoever's completing the referral, if they're doing it for someone else, to put their information in the comments or question box just to better help us navigate. Maybe we're not able to get in contact with the participant, we'll be able to get in touch with the agency that did the referral. So we just ask for you to put the referring agency, the name of the person, making the referral, and some form of contact information, whether it's phone number or email, just a way that we can get back in touch with you. Now, this part at the consent box, I always say this during my presentation. If there's one thing that you take from today, is this part that I'm about to say, which is this box. You have to check this box off in order for us to get in touch with the participant. As you can see, this box is not asterisk, and we have noticed a lot of times that they submit this form and we are not able to contact them because they did not give us consent. All of our programs, again, are free and voluntary. So they need to voluntarily sign up and give us consent is the best way I can explain that. So again, if there's anything that you take from this, is the importance of checking that box off before you submit this referral. So that part. And then this is another way to complete a referral. For example, we work very close with DCPMP, and they complete this form. And it's pretty much the same exact process as a self-referral. The only thing that's a little different is at the bottom, it has referral agency, and you're able to put your information there. And again, we highlighted the oral consent given box because just like the website is also on the form, and it's very important that you check that box off. And then I'm going to forward this form to Miguelina so that you guys can have access to it. And yes, so the box at the bottom, please check it off. And then as you can see here, it says email A. Vargas. She is the Connected New Jersey Resource Supervisor. So she leads all of those 5 counties that I mentioned to you before. And then here, it kind of gives you an idea of all the service referrals that we can provide. And if we do not offer it at the partnership, we can at least make the connection to an organization that's local that can help with that. So for example, clothing and furniture, lead testing, parenting education, GED preparation, job training, the list goes on, breastfeeding centering. And again, usually the community health worker or mainly the community health worker provides these referrals for the participant. And then I also wanted to talk about our community advisory board. The community advisory board meeting aims to have everyone from the community and local organization review updates, discuss challenges, and share resources. The purpose of this meeting is to encourage families and community residents to have the opportunity to join and participate in the planning process. And we meet every quarter, so March, June, September, and December. And we do the CAB meetings for the 5 counties that I mentioned: Bergen, Hudson, Morris, Passaic, and Union. Yes, and Union. And we always encourage community residents to come to this event because what we like to talk about is, different things that are trending in the community and challenges. And if we can, during that meeting, we try to come up with solutions or exchange information so that we can address any issues. Like, for example, at our last CAB meeting, something that came up in Passaic County specifically was their infestation problem that they're facing right now. It's like really bad. So we are trying to come up with ways to help them, whether either contact the Department of Health or Northeast Legal Services, because they do a lot of tenant landlord rights. But that's just an example of, the kind of discussions that we have. And usually at our CAM meetings, we do have presenters, one or two presenters. So if you're interested and you cover one of those counties, you can be a presenter as well. So you can connect with me after this. And as I mentioned, and I keep saying this, but Connecting NJ is a statewide initiative. So even though the partnership covers the 5 counties, each county has a community advisory board. And then another thing that we are working on at the partnership is a community health questionnaire. And this is really just giving us an opportunity to have our ears out in the community and really see what they're going through. We share it at outreach events, at our CAM meetings. And for example, one issue that I never noticed before is that residents are having difficulties making appointments. So, maybe they need to see a specialized doctor and they're contacting them, and the wait period is like 3-4 months from now. So we're hoping, especially as a community alignment program, that we can address this issue and make it more accessible for families. And this is just a comment from the Nurture New Jersey strategic plan. Women and families in this state deserve better. In response, all stakeholders who have the power to initiate change cannot shrink from the challenge of transformative change. And that's pretty much it, you guys. So this is just some questions to kind of get the conversation going, but I would like to know how helpful is sharing this information about the partnership and Connecting NJ, and are the families you serve aware of and accessing these programs and services? And that's my contact information.